And some data say almost 1 million dying of heart attack or a stroke. And half of them, 500,000 of them die all of a sudden heart attack, all of a sudden stroke because they didn't check blood pressure. They didn't check their, all the blood work. They don't know they have a heart disease. They don't know they have their carotid arteries are blocked. They don't know they have a blockage. They don't know they have a heavy metal in the body and allergy an issue. So this is very unfortunate that we are not taking care of ourselves. I said continue the medications you're taking, just take care of yourself with the diet, supplemental needs you need, and some IV therapy. I put it on him as well as acupuncture. So all together, he slowly, about 3 months of the time, he saw that huge progress.
Hello, I'm Dr. McJunkins, Austin McJunkins. Got my degree at University of South Carolina. Did some surgery training. Did 5 years in the Air Force, and now I work at a family practice in North Carolina. We'll be talking to Dr. Haque.
I'm basically came from scientist background. I was a scientist in University of Texas Medical Branch. After finishing my PhD, I decided to start further research on my medicine because my PhD was on bioorganic chemistry, mostly cancer drug. So after finishing my school from University of Wisconsin, I moved to Texas. While I was doing my research on medicine, I realized that our medicine is not enough to fix someone's health problem completely unless you go integrative approach. Then I started focusing on all other healing support that someone need. I went to Harvard for my nutrition program. They have an amazing program. It's called Nutrition, Health, and Science. So I finished that, and then I went to integrative school for integrative medicine certification, functional medicine university for functional medicine certification. So I've been practicing now with a naturopathic background, functional medicine approach, and you can say like integrative approach. I'm helping patient to focus on underlying health issues.
Let's take high blood pressure. Okay, they're on a medication. What is something that they can do to potentially come off that medication, or is it something that they may need it forever?
The patient doesn't want that. Patients always say, I don't want that blood pressure pill forever because high blood pressure apparently is okay, but actually is hurting kidney cell because root of the blood pressure is missing, as you talked earlier, that magnesium, missing the calcium and missing the other minerals as well. And when essential minerals are missing, your body absorb like other mineral like mercury and too much copper, too much like a cadmium and too much aluminum, because you're missing the other essential minerals. So this heavy metal comes to the body, makes the blood thick. When blood gets thickened and you miss the essential minerals, heart need to do overwork to flow the blood, and blood pressure gets high. So in that case, the very first thing you need to focus on the mineral. A lot of patients, simple improving the mineral profile, they get blood pressure become normal. And improving mineral, they need to have mineral blend two ways. One, I tell my patients, you have to have a juice format, all the greens, kale, parsley, cilantro, and then all kinds of celery, beet, carrot. So those minerals and nitric oxide need to be loaded in the system, in the body. Then blood gets thin again. Then blood will heart doesn't need to do overwork. Essentially, at the instantly, they need to start taking high magnesium. They need to start taking high vitamin C, not more than 6 grams, of course. And then they will get improved. Plus, they take all the nutrients from the juice format. But still, some patient doesn't improve if they have too much heavy metal in the glands and everywhere. They need to metal cleanse. They need to cleanse the metal. Also, doctor, I don't know what's your experience. I see a lot of patients have a high food allergy because high food allergy also causing them high blood pressure because too much immune response. That also important. So mineral balance, heavy metal cleanse, allergy check. Also, doctor, insulin resistance is so important to check. High blood pressure, they never check their A1C. They need to check that first. Yeah, because the sugar is inflammatory, and that makes high insulin, that more inflammatory, more, so that's inflammation causing the blood pressure high. And also one more thing we talked earlier, acidic body. If someone, meal have no plants, no fresh produce, vegetables and fruits, their body going to be acidic. They are going to be struggle with a high blood pressure, of course. And right now, 1 out of 3 adult in US have a high blood pressure, which you don't want that. And do you know that 1 out of 2 Americans are dying with a heart attack or a stroke. Imagine we are 2 people. One of us will die in a heart attack or a stroke. We don't want that. We're gonna die about normal death. And half of, so according to data, recent data, 800,000 people, and some data say almost 1 million, dying of heart attack or a stroke. And half of them, 500,000 of them, die all of a sudden heart attack, all of a sudden stroke, because they didn't check blood pressure, they didn't check their, all the, blood work. They don't know they have a heart disease. They don't know they have their carotid arteries are blocked. They don't know they have a blockage. They don't know they have a, heavy metal in the body and allergy and issue. So this is very, unfortunate that we are not taking care of ourselves. And a lot of patients taking pill, they still get heart attack. They still get a heart problem, but because they don't fix that, they don't take care of themselves, because, my doctor said, whatever you eat. Doctor didn't say whatever you eat, but, you need to take care of yourself. The doctor never, this is not doctor job to see your kitchen, So that's the problem. We need to improve our lifestyle, exercise as well, of course. But and in a pill form, doctor, we always give magnesium, CoQ10, very important for the heart to function. We give omega-3 because a lot of inflammation. Omega-3 helps, and we give also sometimes vitamin DK if it's very low. Altogether, blood pressure. I want to share one patient, doctor. He's Chase. Chase, he lives like 10 minutes away from my clinic. Chase could not walk for 20 years. Extreme high blood pressure, 3 medication, kidney was not working. Doctor wants to transplant his kidney, and then he came to me. He found my videos and he saw me in YouTube, and then he came to my clinic. Doctor, you can see he has a couple of interviews. He is now walking and hiking every week. Every weekend he go to different city to enjoy his life, because he thought that he would never walk anymore. And now his blood pressure got normal without any medication. Kidney became EGFR going high. He's now good, out of medication. He got new life. What did I do? Nothing. I said, continue the medications you're taking. Just take care of yourself with the diet, supplemental needs you need, and some IV therapy. I put it on him, some IV therapy, as well as acupuncture, So altogether, he slowly, about 3 months of the time, he saw that huge progress. So you can see his video, doctor. You'll be amazed. He's emotional. He has a couple of videos he shared.
I tell people, especially my new patients, I will never be in control of your health as much as you are. Ever. I never was, and I never will be. And I think they need to understand that. A lot of these things you're saying points that out. Like, I can guide you, I can help you. But the reality is, you are in control of your health more than anyone else ever will be. And patients need to hear this, right? I tell them too, not every pill is solved or not every problem is solved with a pill. Sometimes they are necessary and we use them when we need to, but
exactly,
that's not the solution. Not the solution for every problem.